Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Causes of the small and dilated pupils. So first we look at the causes of the small pupils. So when you look at small pupils, it can be caused due to the pontine hemorrhages. So it is due to the pontine hemorrhages. So pontine hemorrhages can be a cause, and then it can also be due to the Horner's syndrome. So it can be due to the Horner's syndrome. Next is it can be due to the presence of old age. So it may be due to the old age, it may be due to the AR pupil, that is Arjen-Robertson pupil, as well as the drugs and the poisons, So this includes the opiates and the organophosphates. So it includes the opiates as well as the OP, that is the organophosphates. So to recap, the pontine hemorrhage, the Horner syndrome, the old age AR pupil, as well as the drugs and poisonous, that is opiates and the OP, organophosphates. Next is we look at the causes for the dilated pupil. So dilated pupil may be due to the HA pupil, that is the Holmes Adie's, that is myotonic pupil. Then comes the third nerve palsy. Then it may be due to the third nerve palsy. Then comes the presence of the atropine. Then is the carbon monoxide as well as the ethylene glycol. So Holmes Adie's pupil, the third nerve palsy, atropine, carbon monoxide as well as the ethylene glycol. To learn and grow daily like this, please do subscribe.